Hello, and welcome to Voices in Leadership from the Harvard T.H. Chan School of Public Health. I'm Eric Anderson, the director of this program, and it is my pleasure to welcome you today for another exciting installment. Our goal with Voices in Leadership is to focus on effective leadership to create positive change in public health. Since last March, we are creating a special focus on what it takes to lead during a pandemic, while also addressing issues such as systemic racial reckonings and other critical public health issues. Today, we welcome Congresswoman Ayanna Pressley. Congresswoman Pressley represents the 7th Congressional District in Massachusetts. Elected to the House of Representatives in 2018, she was previously a member of the Boston City Council, when she was elected as the first woman of color in the 100-year history of the council. In our program today, Congresswoman Pressley will discuss what inspired her to become an advocate for justice and equity throughout her career, and how she has been fighting on behalf of her constituents and all Americans who are affected by the scourge of systemic racism and related injustices. She will be joined in conversation with Michelle Williams, Dean of the Harvard T.H. Chan School of Public Health, and by Jeffrey Sánchez, former state representative and lecturer at the Harvard T.H. Chan School of Public Health. Dean Williams and Representative Sánchez, I turn this discussion over to you. Thank you.
Thanks so much, Eric. Welcome, everyone, and a special welcome to all of our students. This is National Public Health Week, and today, Thursday, April 8th, is Student Day, so welcome. And welcome, Congresswoman Pressley. It really is a privilege and an honor to have you with us today. Jeffrey and I have been looking forward to having this opportunity to chat with you, so let's just jump right in. Since at a very early age, you have been a leader and a change agent. In high school, you were class president. When you came to Boston University, you were a student leader. You spent 4 years working with Congressman Joseph P. Kennedy II, and 11 years working for John Kerry. Then you ran for Boston City Council, and on your first campaign, you were elected as the first person of color in the council's history. 8 years later, you defeated a 10-term incumbent for Congress by 17 points. All along the way, you've been a champion for justice and equity. So, Congresswoman, what are your sources of inspiration? What's propelled you over the decades? Simply put, what makes you tick?
First of all, thank you again for the invitation to join you and to sit at this virtual table. I have to just be fully transparent and authentic to who I am and say that although Harvard broke my heart when they rejected me as an undergrad, I do appreciate that I'm often invited to be in thought leadership with you. And so I thank you for that. But what makes me tick? So behind me, there's a painting of Shirley Chisholm. And, I grew up in a household where my mother certainly, in a single parent household where my mother believed that a parent is a child's first teacher. And I had an extraordinary educator in her, both in her example and in what she poured into me. My mother held many jobs, but those that most resonate with me is that she was a tenants' rights organizer with the Urban League of Chicago. She was a community activist. She was a super voter. She was a social worker. And my mother told me early on, to be Black is a beautiful thing and something to be proud of, but make no mistake about it, you were being born into a struggle. And I have an expectation that you will do your part in that struggle. And my mother did not read me traditional bedtime stories as a child. She never condescended or patronized me. She saw me as a little person, really. And so for that reason, because it was just the two of us, and so she read me the speeches of Barbara Jordan and Shirley Chisholm. And so I feel mentored by their examples. And I'll just close here in saying that also growing up in a city like Chicago, where I did have the good fortune of seeing a woman mayor in Jane Byrne and the city's first Black mayor in Harold Washington, which was actually the first campaign I worked on at the age of 10. So I was at my first tenants' rights march at 3 months old. My first campaign venture was at the age of 10. So I've been doing the work of movement building and seeking to realize social, racial, and economic justice since I was in the womb. Again, thanks to the righteous example of my mother, may she rest in peace and power. So she remains the most formidable influence in my life.
Powerful Black women leaders throughout your life. Thanks for that. Jeff?
Yeah, thank you.
Thank you so much for doing this with us today, Congresswoman Pressley, and it's an honor to be able to say that, given the years that I've seen you on the ground in our communities from day one, and seeing how it's translated to all of the initiatives that you devoted to your life, and frankly hit the ground running in Congress and continue here in our community in pushing people and pushing policy forward. And what's interesting is that you in everything that you say that policy is your love language. As somebody who spent 16 years in a legislative body, that those aren't the four letters that we particularly used when I was in the legislative body. But I do like the way that you're trying to change the language of how we talk about the work that you have before you. Can you talk to us about what that means to you, that love language within a new Congress, a divided Congress, a new administration, and how do you tend to articulate and use that language further as you move into the session?
Sure. Well, the reason why that is more than a mantra, but is a lived practice, policy is my love language, is because I have seen and experienced hurt and harm that has been disproportionately foisted onto Black Americans and other marginalized communities, resulting in deep inequities and disparities and racial injustices that have only been exacerbated by this pandemic. And none of those disparities are naturally occurring. They were all legislated. And so we have codified in our lawmaking hurt and harm, resulting in disparate outcomes across every issue, again, in racial injustices. And so I'm of the opinion that if we can legislate hurt and harm, then I do believe that we can legislate healing, that we can legislate equity, that we can legislate justice. And so far as, changing the language, I think that's where all movements begin. And, I am doing the radical work, and I define radical in the same way that Angela Y. Davis does, which is to get at the root of something. I am doing the radical work, seeking to usher in a paradigm of politics that is about transformation and not transaction. I'm seeking to replace systems and policies of oppression with systems and policies of liberation, and to replace systems which have perpetuated and policies that have perpetuated trauma with systems and policies of healing. And when you give an example like redlining, right? I serve on the Financial Services Committee. That is a practice that still persists, and that is an example of discriminatory lawmaking, which has resulted in great injustice. So if we can be that precise in creating harm, then we can be just as precise in creating equity.
That's powerful response. And I want to continue on two areas, Congresswoman. Movements begin with language, and policies bring scale to transformation. So I want to turn our attention to the fact that the language, the narrative across our nation is changing, where leaders are now declaring racism as a public health crisis. And of course, those declarations are nice, but they are just declarations until we really bring operational intelligence, intentionality, and deliberation to the process. I'd like to ask you about the bills that you have sponsored that address systemic racism and public health issues. And we could start with criminal justice reform, for example. You've recently reintroduced the People's Justice Guarantee to transform clinical legal systems, which is dedicated to eradicating racism, sexism, xenophobia, and other forms of systemic oppression. I'd like to note that that both your father and your husband served time in prison, and should note that they both received degrees following their time in prison and are both now successful. Is your passion for prison reform inspired by your own family's experiences?
Well, I think it's important to note that both, my father and my husband are Black men, so certainly, given the generational trauma that is mass incarceration that has been disproportionately bore by Black and Brown communities, certainly my own lived experiences shape my policy agenda. I've always maintained the people closest to the pain should be closest to the power, driving and informing the policy making. And so I've been close to that pain. I know the destabilization and the stigma and the loss and the trauma of having an incarcerated loved one. But I am no anomaly. In the Massachusetts 7th Congressional District, a district that is vibrant, diverse, and dynamic, and sadly, the most unequal in our delegation, but arguably, and the data supports this, one of the most unequal in our country. In the Massachusetts 7th, 1 out of 4 children in my district have an incarcerated loved one, and nationally, 1 in 25 do. And again, to quote Angela Davis, people think that social problems go to jail, but human beings do. And so with the People's Justice Guarantee, what I'm seeking to do is to create it's a radical reimagining. It's a new framework for how we truly get to a just criminal legal system, one that centers the humanity and dignity of all people. But the goals ultimately are to decarcerate. It's my response to mass incarceration is to seek to decriminalize those low-level offenses, to decriminalize disease. My father is a brilliant man, was always gifted. He self-medicated that was his response to a lifetime of trauma, being the eldest boy in a family of 5 children who were orphaned very young, and he had a great deal of responsibility. And so, my father, I believe what he deserved was on-demand, culturally competent treatment, not incarceration. And of course, while he was incarcerated, he attained 2 advanced degrees and subsequently went on to become a college professor of journalism and is a published author. I'm very proud of him. The point is, he should not have been incarcerated in the first place. But because we criminalize social conditions, because we criminalize disease, I'll try to transition here and just say this. The Massachusetts 7th is in the top 9, I think, of undercounted districts when it comes to the census. Because we're undercounted, we're also under-resourced in terms of federal investment. So when you underinvest in community, or you divest in community, you're not investing in people. You're not investing in that critical infrastructure that fosters an ecosystem whereby people can live and thrive. And then people have no choice but to default to survival behavior. And then we criminalize that survival behavior. That is how you have a public health crisis and an injustice like mass incarceration that we see today. So the People's Justice Guarantee is a radical reimagining, centering the humanity and dignity of all people, and it seeks to get us to decarceration by decriminalizing substance use, mental health, poverty, homelessness, all things that we currently criminalize.
Bringing a public health approach to what is mental health, physical health, social determinants of health.
Absolutely. You're speaking my language, Dean. You're speaking my language.
I love it.
And I do also want to say, there are 5 foundational principles for the PJG. And under those, I've introduced a number of pieces of legislation to support this new framework: abolishing the federal death penalty, ending qualified immunity, counseling, not criminalization, the End Push Out Act. And there is much more in the queue there. I introduced a bill to dismantle mass incarceration for the public health, justice for incarcerated moms, which is crazy that I have to legislate decency, justice for incarcerated moms. Why is any pregnant woman incarcerated? Being shackled while giving birth? We have to introduce anti-shackling legislation.
We have to introduce compassion. We have to bring passion back. And that's why I love your terming this your love language. Jeffrey, thanks for opening up that question with the love language. And I want to turn back over to you. Thank you, Congresswoman.
Yeah.
Thank you, Dean.
Congresswoman, you've said that creating a just legal system is a matter of will, plain and simple. Back in 2018, I remember the work that we did here in Massachusetts together on criminal justice reform and court reform, and then now leading up to police reform here in Massachusetts, ultimately knowing that you had to hit the ground, you had to hit running. Really difficult conversations to get to some, and take advantage of an environment of which we're in now, especially after the murder of George Floyd. Do you believe that there is a will, or can we, in such a deeply divided Congress, try and address this issue of criminal justice reform, court reform, police reform?
You know, I believe as an elected official, it's my job to not only reflect the temperature of the people, which is why I seek to stay proximate to the hurt, right? Both to better understand how intersectional systems of oppression are, to better understand nuance and complexity, but also to develop the best solutions. And so I think it's my job to reflect the temperature of the people, but it's also my responsibility to set the temperature. And I do that in partnership with community and with my colleagues. So, you know, I'm no cynic, I'm an eternal optimist, but I have very few illusions of sort of GOP epiphanies on a host of issues, you know, that include real transformational, people-centered criminal justice reform. But that just means we have to continue to organize and to mobilize and to apply that pressure.
Are there any moments, again, just trying to get into the building and in your own experiences and trying to get at other members, what do some of those conversations look like?
You know, I believe in the power of storytelling. And so as much as I can center the voices, again, of those closest to the pain, that's when I find that I have been able, I mean, you know this from being a legislator, you know this from being a legislator, that if you can change hearts and minds, then you can change laws. And so, you know, I've always asserted that we don't suffer from a deficit of resource as a nation, but we do suffer from a deficit of empathy. Which is why there is scarcity, even though we have enough resource, even though we have what we need at our disposal. And so as a way to foster that empathy, I just center those who are closest to the issue. And so you know, in those one-on-one conversations, you know, you can see people, you know, maybe thinking about these things a little bit differently. But I also need people to know that although I'm very encouraged by the passage of the George Floyd Justice and Policing Act, which bans chokeholds, which would have saved George Floyd's life, which bans no-knock warrants, which would have saved Breonna Taylor's life. You know, no one bill is going to undo centuries of harm. So, you know, if we are really finding ourselves in the midst of a reckoning, well, I grew up in the church. That was really my real leadership development, on a storefront church that my grandfather pastored on the south side of Chicago called Rain or Shine. And, you know, a reckoning is something biblical. You know, it's of epic proportion. So if we are really in the midst of a reckoning, then what is our commiserate, you know, comparable response to this reckoning of racial injustice? It's going to have to be more than one bill in order for us to achieve a deep, systemic, transformational change. But it is necessary that we do that hard work. So all I can do is just continue to organize, to mobilize, and again, to center real people in my advocacy.
Thank you for such a great response. Dean Williams?
Yeah, thank you, Jeffrey. Congresswoman, I'd like to switch gears a little bit to talk a little bit about gun reform and gun safety. You know, you mentioned the power of stories. And, you know, just in the last 10 years, we have seen so many powerful stories, local, daily, weekly, national stories about trauma that's brought about to all of our communities because of gun violence. And during your tenure, you know, both on the city council and now in Congress, I know gun violence is one of these very big issues. Can you talk about why this is important to you and what is it going to take for us to move the needle? There are plenty of stories out there. We can't just legislate ourselves out of this. So what's the strategy for really cracking this nut?
Yeah, well, yeah, in my 8-year tenure on the Boston City Council, one of the things I'm proudest of is having introduced, which is still standing, and I hope it will exist in perpetuity, a policy committee called the Committee on Healthy Women, Families, and Communities. And it was the first committee, and it was actually replicated in other municipalities throughout the country, and a handful of them. It was the first committee on the Boston City Council to name the issue of trauma. And at that time, I was having to do a lot of educating about, what it is. But once we were able to get people to wrap their minds around what is trauma, then we got them to appreciate that, violence in all its forms, gun violence included, first of all, is connected, right? You know, sexual violence, domestic assault, gun violence, there's a real interconnectedness to many of these issues. And it has wrought great trauma, community-based violence, school shootings, mass shootings. During my time on the Boston City Council, I convened the first ever listening only hearing where we brought in almost 400 families, surviving family members who had lost their loved ones to gun violence, to speak to what their hurt is, what their experiences are, what their trauma is. And so then I've taken that work to the federal level and actually convened the first ever hearing on childhood trauma in Congress. And I did that under the leadership of Chairman Elijah Cummings, who I miss every day, as a member of the Oversight Committee. So, this is a public health issue. And I just continue to do this work of how do we combat and mitigate trauma. And that is about addressing those social determinants. How do we support surviving family members? And of course, we need to do things like ban assault weapons, and we need background checks. These are things that, save lives immediately. But we also have to address straw purchasing and gun trafficking, and we have to address poverty. Those three things are really what contribute to community-based violence. So community-based violence I see as a byproduct of poverty, which is why we have to address those broader social determinants. And then, of course, the things that I've already offered around, assault bans, background checks, and things like that, in terms of the gun violence that we see that is pervasive in other ways: domestic violence, school shootings, mass shootings.
Yeah. So it takes a comprehensive response. If I may, I wondered if you'd encountered people who are denying that these mass shootings, these major violent crimes that happen within schools, for example. I'm thinking of Parkland. And they're actually misinformation campaigns, people denying that these things happen. How do we get around that pernicious misinformation to really help people understand that these are real sources of trauma in our communities and our schools in particular?
The thing is, Dean, what I'm seeking is equitable awareness and outrage. I want us to be equally committed to mitigating the trauma of those students at a school shooting as we are our young people who are exposed to gun violence and have lost their peers every single day. As far as what those conversations are and how they go, it depends on the member. But usually the response for those who are just completely removed from how this is a transcendent public health issue. This is a threat to the public health and the safety of suburban communities, of rural communities, of urban communities. Again, when you're talking about everything from suicide to domestic violence, to community-based violence, to school shootings, to mass shootings. Look, I serve with people who needed an insurrection coming to the steps of the United States Capitol, an attempted coup, to truly even accept that white supremacy is a threat to every American life in our democracy. Mm. So this is what we are up against, but we have to organize and legislate like lives depend on it, because they do. Yeah. The fact that we have colleagues who served with Gabby Giffords, who almost lost her life We have colleagues who played on the softball team who were, ducking from bullets. We have colleagues who represent these districts that have tragically experienced school shootings and mass shootings. So there is just it's very challenging, but I'm encouraged that President Biden is, rolled out today executive actions that he's seeking to advance, because we have to move. It's a matter of life and death. It's a matter of the public health.
Thank you. Jeff?
Congresswoman, with your leadership here in Massachusetts, we have the strongest gun laws in the nation, pretty much. And it reflects in our low per capita incidences of gun violence here in the Commonwealth. The laws are strong, and there's always an openness to talk about reforming gun laws. And I remember and even before that, when we were talking about the background checks, having Republican members and actually the Action League having conversations with us, the Democrats at the time, really made a difference. With what's happening at the national level, with the NRA having some kinks in their armor, do you think that there's some window of opportunity to be able to bring the largest vote, the largest group and advocacy group on gun rights to the table?
Well, look, so let me try to hit this, granddaughter of a Baptist preacher succinctly here, because there's so much to get at here. So the first thing I want to say is that we need to end the filibuster. We need to abolish the filibuster, okay? That has been an obstruction to progress on everything from restoring voting rights, to passing an anti-lynching bill, to passing legislation to reduce the cost of prescription drugs, to passing an infrastructure bill, to gun violence reform. So we need to abolish the filibuster, but I do believe, sadly, and once again, it takes great tragedy for there to be a prompt and an impetus to really get people's attention here. But look, I'm a firm believer in that you just organize and you mobilize. The power of the people has always been greater than the people in power. We have to be sustainable in our outrage. And I'm gonna, do my best to center the lived experiences and to amplify the stories of those who have been directly impacted, in the hopes that my colleagues see the light. But if they don't see the light, then we will bring the fire. And then we will bring that fire in the form of organizing and mobilizing, and in what we do at the ballot box. Now, the last thing I will say is that we have got to pass H.R. 1, because that is not only critical to our democracy in terms of access to the ballot, but also in rooting out the influence of dark money, of big lobbies like the NRA. That is so important. These folks are not moving because they are bought and paid for. It's the same reason why we haven't been able to pass legislation to reduce the cost of prescription drugs, because of the influence of that lobby. So the same is true when it comes to the NRA.
So moving on, let's tackle anti-racism in public health. This pandemic has laid bare the entrenched racial disparities in our public health systems in this country. This summer, the dean and I fortunate in being a pen and op-ed on the issue, and we were so happy with what you introduced relative to this issue of racism being a public health crisis, because we know that the Black community and Latinos are 3 times more likely to contract COVID-19 and 2 times more likely to succumb to the illness altogether. And with Senator Warren and Congresswoman Barbara Lee, you introduced the Anti-Racism and Public Health Act. If signed into law, how will this impact, and how will the impact be measured, and what impact do you hope the act will have?
So I said that throughout this, we've been elevating my practice of policy is my love language. Well, policies that seek to mitigate the harm caused by anti-Black and racist policies is really my love language. And that's what the Anti-Racism in Public Health Act would do. This is going to confront and dismantle racist systems and practices that have created the inequities that you enumerated and that we see in the Massachusetts 7th every day, which is why the Massachusetts 7th was the hardest hit by the pandemic, which we knew would be the case anecdotally. In a 3-mile radius in my district from Cambridge to Roxbury, life expectancy drops by 30 years. And we know that the coronavirus has contributed to that, significantly. To changing life expectancy there. So these inequities and these disparities in public health outcomes, again, have been created by policies which have created comorbidities of structural racism, unequal access to healthcare. And so the Anti-Racism in Public Health Act is going to would allow for robust, comprehensive research on the public health impacts of structural racism, and then seek to develop policy solutions to bring an end to these disparities once and for all. So I love data, not data for data's sake, but to directly inform how we legislate and where resources go. So the Anti-Racism in Public Health Act will also expand research and investment into the public health impacts of structural racism. It requires the federal government to begin actively developing anti-racist health policy. Something else that is unique to this act is that it acknowledges that police brutality is a public health crisis. In fact, police brutality is the 6th leading cause of death for Black men. And so we are creating, through this act, a law enforcement violence prevention program within the National Center for Injury and Prevention Control under the CDC. So, I don't want to get too wonky about it, but it's just the acknowledgement.
Be wonky. This is the environment. Let me tell you.
Yeah,
time is only killing. I don't think we have hours.
Be wonky, bring it on. You said, I love data.
I do. And okay, so you said it. Okay, so really quickly, listen, that is why early in the pandemic, I introduced with Senator Warren the Equitable Data Collection Act, because that which gets measured gets done. The CDC was only collecting age and gender. When it came to coronavirus infections, hospitalization and fatalities. But when we introduced that law, which some of it was integrated into the relief package, to mandate the collection of racial demographic data, then we got the full story. And because we had that full story, even though we knew anecdotally how it was going to play out, we have the highest asthma rates, environmental injustices, unequal access to healthcare, food apartheid systems, subpar overcrowded housing, transportation deserts, all of these things. But the data gave us the mandate to seek those investments.
Yes.
So with the data and research that we will do in the Anti-Racism in Public Health Act, we have to pass it first. That will conduct the research and gather the data to actively advance anti-racist health policies.
Yeah. Amen. Amen. We're in church here today.
No.
So I have to say something, because you segued beautifully into what management guru Peter Drucker once said, which is only what's measured gets managed, right? And your leadership in mandating reporting of COVID-19 data by race and ethnicity in particular has been crucial. However, despite all of your hard work, race ethnicity data continues to be unacceptably absent in very high levels, upwards of 46% missing information on race ethnicity for COVID cases, 24% missing information on race ethnicity for COVID related deaths. And now with vaccines, these most spectacular public health goods that should be closing disparities, we are missing upwards of 45% of where vaccine doses are going according to race and ethnicity. What options exist for enforcement of these mandates?
Wow, yeah, it's really just about, honestly, oversight, because every law is only as good as its enforcement. And so as we've introduced these bills, because even after our Equitable Data Collection Act, tenets of that were included, again, what we were getting back was not, in the prior administration anyway, was not consistent with what the law had mandated. So it is about, oversight and being vigilant in that regard. And similarly to what we did early in the pandemic, when it comes to vaccine distribution, we also lobbied the new administration and the Department of Health and Human Services to collect anonymized racial demographic data for vaccine recipients. And what's key in the data collection, both in the Equitable Data Collection Act and in our advocacy around the vaccine, is that we're asking for that data to be collected, disaggregated, and reported in real time, because this is about saving lives. And so what we have to guard against are patterns of vaccine redlining, resulting in inequitable access to communities that have been the hardest hit, for all the reasons that I've already enumerated, while also dominating essential workforces as well. So we can't have those communities that have been disproportionately impacted, not accessing the vaccine. So one of the things that we did do in the American Rescue Plan, and I fought for this, was that we make those massive investments to support community-based efforts in partnership with community health centers. I have the most community health centers of any district in our delegation, perhaps in the country. So I led the fight. We secured $7.6 billion for our community health centers. 1 in 3 of my constituents receives their care from a community health center. And so that's $7.6 billion, and the specific investments that we have fought for relative to equity, but really focusing on resourcing those trusted voices and those community-based partners, I think is going to go a long way. So this is about, we keep lobbying, we keep legislating, conduct oversight, be vigilant, and then make sure that we are enabling those closest to the pain, those community-based organizations, those trusted voices as partners in this fight and in this work.
Wow, another comprehensive response. Thank you, Congresswoman. Jeffrey, over to you.
Congresswoman, the history of pernicious racism in public health contributes to vaccine hesitancy amongst Black and Brown communities, Black and Hispanic communities, particularly. I want to say thank you for visiting Chelsea, Massachusetts a couple weeks ago, and La Colaborativa, and the work that they're doing under incredible pressure and incredible challenge. What did you learn being out there? Because I think it's, I love the way that you've been talking about how you come up with your in your advocacy, your road to making your decision on how you're going to advocate and how are you going to stand for things. Could you let us know a little bit about that visit and what it contributed to you as you're telling stories? Because I remember Gladys telling you and asking you, please take stories up, please take stories up. And not only that, what are the messages to those that can give to all of this audience, this great audience that we have here today, to be able to be your army of people to talk about hesitancy and how do we get through this?
So again, my time in Chelsea, my time in Roxbury, my time in Randolph, seeing their vaccine sites confirmed what I already knew, that when you resource those closest to the pain, those community-based organizations, like the Chelsea Collaborative under the leadership of the indefatigable Gladys Vega, like the Black Boston COVID Coalition at the Reggie Lewis Center, spearheaded by Senator Wilkerson and others, like what I saw yesterday in Randolph at their intergenerational center, that when you do that, they are able to combat the misinformation the fear and the skepticism, because they are already trusted voices. They are in relationship with these people. Yesterday, I saw in Randolph, they have a drive-through vaccination site. And even though people had signed up online, had filled out paperwork while they were waiting to get up to enter the building, there's one more person, a last person that speaks to them just as they're going in. And there are many who try to turn away in that moment because of the fear and skepticism, but because that is a member of their community and someone that they know who is not discrediting their fear, bearing in mind that the medical community violated that trust. The practice of medical apartheid on Black Americans, on Indigenous people, on Guatemalans, and there are many other examples that I could offer to other communities, was the medical community violated that trust. And it's incumbent upon the community to regain that trust. And so, you can't talk people out of their fear. That's why it's best to have someone who's a trusted voice. I mean, because sometimes people are dismissive of it. That's what I mean. You can talk people out of it by educating them. And if you're someone that has a relationship with them and that they trust. But the thing here is to not be dismissive of it. You can't be cavalier, because those fears are real, okay? And I will acknowledge, even for myself, as someone who's a public health champion, I had to overcome my own fear. Now, what helped me was I got the answers I needed around the diversity of vaccine trial participants, that there were Black folks who were part of those trials, and that people like Dr. Kizzy Corbett developed the vaccine. Now we have 3. But those are the sorts of things that helped me to get over that hurdle. But what I learned in Chelsea, Randolph, and Roxbury was confirmation that we just need to empower and well-resource our community health centers, community-based organizations, so that they can go door to door, have mobile units deployed, and really meet people where they are to get them vaccinated, particularly as we continue to see emerging variants.
That is such a powerful response, Congresswoman, that I can't help but be reminded of a line in Heather McGhee's book, The Sum of Us, where she says, if we as a nation could only embrace our diversity, we would unlock that superpower that we have. And as you talked about, the diversity of participants in the clinical trials that led to these spectacular vaccines, the diversity of the scientist, an African-American woman, Dr. Kizzmekia Colbert, as one of the founding brilliant scientists bringing forward this mRNA platform vaccine. It is the diversity of our nation, the talents, the stories that really can unlock the superpower of our nation. It is diverse and powerful voices such as yours, Congresswoman, that inspires us, that motivates us in public health to want to continue to do more to help us build back better. I can't thank you enough for choosing to spend time with us, for bringing your love language of policy infused with data that allows for strategic investments to close disparities, not grow them. So with this, I thank you enormously on behalf of the Harvard Chan School of Public Health and my good friend, former Representative Jeff Sánchez, for engaging in this conversation. And please know, anything that we can do to help motorize, bring power, enable your success, because your success is our success, don't hesitate to let us know.
Thank you. Thank you. Grateful for your partnership. Grateful for your thought leadership. Grateful for your civic engagement, and grateful for the platform and the opportunity to sit at this virtual table with all of you. So, Harvard, you're forgiven. I just want to say that.
Even Harvard makes mistakes.
You're forgiven.
but their greatest success was bringing this Dean Michelle Williams to this place. And
That's
she's
right.
doing an incredible job.
Yes, she
and
is.
We're proud of her.
A history maker, both of you in your own right. So as I tell our young people, history is not something that is static. It is dynamic, and it is all around us. And you know, each of you are history makers. So it's an honor to know you and to sit at this table with you. And I hope you'll have me back.
Can't
Thank
wait to
you
see
so
you in
much.
person, Congresswoman. Thank you.
Thank you.
Well, we will be, to our audience, thank you for spending time with us again this afternoon. And I want you to know that we'll be bringing you more voices in leadership during crisis segments in the weeks ahead. Please stay tuned, and thanks for joining us today. Be well. Thank you.
Thank you.